अस्पतालों में जाते तो हैं सब ठीक होने, लेकिन कई बार ऐसा भी देखने में आया है कि लोग जाते तो हैं अस्पताल ठीक होने और साथ में कभी कभी बीमारियां ओढ़ कर चले आते हैं। इन बीमारियों का कारण कई बार अस्पताल में मौजूद इन्फेक्शन भी होता है। नमस्कार, आप देख रहे हैं हिंदुस्तान समाचार का डिजिटल प्लेटफॉर्म एच डिजिटल और मैं हूं आपके साथ राजित सिन्हा। इस अंक में हमारे विशेष मेहमान बिल पामर मौजूद हैं जो अमेरिका से हैं और इस बारे में वे हमसे कुछ बात करेंगे। बिल, वेलकम टू इंडिया।
Thank you very much. Thank you for having me.
Thank you. You have done extensive research on airborne infections. Could you just throw some light how it impacts or affects the service quality in hospitals?
When you think about other industries, you would never send a construction worker on a construction job without a safety helmet, without gloves, without boots, and because we know that there is a risk. But in healthcare, we often will send healthcare workers without any infection control to protect them. And I think it's important that people, when they go to work, know that they are safe, that they are protected. Hospitals should be a place of healing. And lately, it seems as if they have been viewed as a harmful host and not a healing place. So there are many different diseases that are present in the hospital, both on surfaces and in the air. And they present a risk to the patients and to the medical staff. And our goal is to protect both of them.
What's the kind of research data you have available? I mean, what's the reason of your argument that you feel that hospitals could be unsafe rather than safe?
There have been many research projects done in various countries. For instance, when it comes to tuberculosis, healthcare workers in what would be considered low to moderate income countries have a much higher risk of contracting tuberculosis than the average person in the community. For instance, a worker in the OPD might be 200 or 300% more likely to contract tuberculosis at work than someone in the community. Someone working in a laboratory in the hospital may be 1,000 times more likely to contract tuberculosis. So this research has been done in not just India, not just the US, but in many countries, and it is a understood common risk that is ever present in hospitals.
Risk. You mentioned that risk is there, but do you feel that governments as well as private players in the healthcare industry are taking adequate safeguards, or there is more need to be done?
I think that there is always more that we can do. And I think that most people have their heart in the right place, and their goal is to have a safe hospital environment. That said, I do think there are many things that can be done that either are not fully understood or people are not aware of these things that are options for them to do to protect their people.
Okay. You feel that this industry of providing safeguards in this area is gearing up, or the market is open, or what kind of has been your experience in this space?
So I have been doing airborne infection control since the early 1990s. And in the US, we had an outbreak of tuberculosis in the 1990s. And this helped us to really focus on infection control because there was a level of fear associated with this outbreak that we were seeing an increase in the rate of tuberculosis for the first time in over 100 years. And around the same time, we were becoming knowledgeable about many new diseases, HIV and AIDS and hepatitis and all of these other things that were coming about were helping us to realize that we were not doing enough to protect people in those settings. So we had a huge increase in the focus and in the importance placed upon infection control in healthcare settings. And it's taken some time for this to, I guess you would say, catch on in some other countries. I think that it's always been important, but people are now starting to realize that there is more that they are capable of doing. So I see this as a ever growing in importance and ever growing in awareness in this market. Well, I refer to it as a market, but it's where people are. It's where they're working. It's where they're receiving health care. There's a much greater attention that is currently being paid than was being paid in the past.
Now, coronavirus is making news everywhere.
Right.
What do you feel? This can also be prevented or could have been prevented, or the chances or the risks can be minimized by taking care of or some adequate safeguards? Can this be minimized? What's your opinion?
Well, I think that there is definitely some things that can be done to reduce the risk. And it's important to, when we talk about risk, we're not talking about elimination of risk. There's nothing that we can do that will totally eliminate risk for anything. But we are talking about dramatically reducing risk. Coronavirus is spread both by contact and through the air. And we saw that with the SARS epidemic in the early 2002, 2003, when we experienced that epidemic at that time. So there are things that can be done for surface decontamination. We can clean our surfaces more frequently. We could clean them better. And for airborne infection control, there are things like the use of ultraviolet lights that can reduce the concentration of infectious particles in the air, whether it's a coronavirus or measles or SARS or tuberculosis. All of these things, when in the air, will act similarly, and we can control them with similar techniques. So there are definitely things that can be done that are available to us right now.
Thank you very much, Bill, for talking to HS News. Wish you good luck.
Thank you, Rajit.
My pleasure.
Have a wonderful day.
तो ये थे बिल पामर, जो हमें बता रहे थे कि एयरबॉर्न इन्फेक्शन से निपटना कितने ज़रूरी है और इस बारे में उनका क्या अनुभव रहा है। ताज़ा खबरों के लिए आप देखते रहें HS डिजिटल। नमस्कार।
देश और दुनिया से जुड़ी सभी प्रमुख खबरों के लिए हमारे चैनल को सब्सक्राइब करें और लेटेस्ट वीडियो पाने के लिए बेल आइकन को जरूर दबाएं। साथ ही हमारे वीडियो को लाइक और शेयर करना ना भूलें।